Okay, so let's try and unpack this. Imagine you're looking at, that specific reflective essay for a global health module. The kind where you've got to connect some focused activity to these huge, like, worldwide ideas and professional standards. It feels a bit big, right? Maybe a little daunting. What if you had a sort of guide? Like, you could sit in on the session with the people who really know what's needed.
Cutting through all the noise, yeah,
Yeah.
and just zeroing in on what truly matters for this specific task.
Yeah, that's exactly what we're doing today, actually. We've got the source material from a guidance session that was specifically designed to help students navigate this particular 1,000-word reflective essay.
Right. So our mission today is pretty clear. We're going to pull out the absolute core instructions, the key expectations, and also those tricky bits, the common pitfalls that were talked about in that guidance. We want to basically distill the essential insights you'll need to approach this specific writing task with, well, a bit more confidence. Exactly. And this essay, it's reflective, obviously. So it's asking you to look inwards at your own learning journey. It uses a template they provide and a rubric, too, which is sort of your map. You absolutely have to relate it back to an activity you chose, maybe something you looked into on alcohol or tobacco, perhaps vaccines, and like a total non-negotiable, connecting it all to the NMC Code. Oh, and just a quick heads up from the notes, the resubmission date mentioned in that session was July 21st, just FYI.
Okay. So even if this isn't the exact essay you're working on, why should you listen? Why does this deep dive matter? Well, because learning how to take a specific experience, make sense of it with broader global ideas, and then tie it all to professional standards, that's a really valuable skill, isn't it? It goes way beyond just this one assignment. Whether you are writing this essay or maybe you're just curious about how you bridge that gap between local stuff and the global picture in your own thinking, you'll probably pick up some key strategies here.
Absolutely. And the guidance, it really hammered home the structure and some key principles. Maybe we should start there. With those basic rules, before we walk through the template itself.
Good idea. So right off the bat, they stressed, and this seems crucial, the essay must relate to that specific activity you chose back in week 2. Everything flows from that. You can't just write, like, a general essay on global health issues.
Nope. And because it's reflective, you've got to write in the first person, using I. It's about your learning, your insights that came from doing that activity.
And this is important, just saying, I think this isn't quite enough on its own, is it?
No, definitely not. They were really clear. You absolutely have to back up your points, your reflections with references. So, academic rigor still counts, even when it's reflective.
Okay. And the big picture connection. Everything you talk about, every point you make has to somehow link back to you as a future nurse. And really importantly, how it connects to the NMC Code. You've got to keep that professional compass in view the whole time.
Exactly. So with those core ideas in mind, shall we walk through the template sections, see what the guidance said for each bit?
Yeah, let's do it. Starting with the simplest part first, activity title.
Yeah. Couldn't be much simpler. Just copy and paste the exact title of your activity from the module stuff. Don't tweak the wording at all.
Right, easy win. Okay, now moving into the actual substance. The first part of the Rolfe model in the template is the what.
Okay, so this is your descriptive bit. You need to describe the activity you chose and what you actually did or looked at as part of that task in week 2.
But the focus here isn't just describing the activity itself, is it? The guidance suggested the key is what you learned, or maybe even more, what you plan to learn.
Exactly. It links straight back to those learning needs you were supposed to set for yourself in week 1 and think about again in week 2.
So you need to think about where you started. Your initial grasp of the problem, alcohol, tobacco, vaccines, whatever it was, and what specific gap in your knowledge you hoped that activity would help you fill.
Yeah. And this part is mostly descriptive. It's telling the reader what happened or what I did and what I intended to learn.
And they mentioned the word count here is pretty tight. So it's about giving an overview, focusing on the activity and your learning goal, not like every single tiny detail.
Okay, right. Now, here's where the essay really opens up, where you get space to explore the deeper connections. The next section, the so what.
Yes, this was highlighted as kind of the core, wasn't it? Connecting your specific learning from the activity to that wider global picture. It covers learning outcomes 1 and 2, and the guidance said it gets a bigger chunk of the word count, maybe 300 to 400 words.
Yeah, this is your chance to link what you learned from your chosen activity to those broader themes from week 1 and 2. Things like the wider determinants of health.
You mean those non-medical things like poverty, environment, education, that stuff?
Exactly. That stuff that really shapes health. And also linking it to global patterns of disease.
They gave quite a strong example for this bit, didn't they, about comparing things between countries.
They did. Like comparing policies, say, laws around alcohol or tobacco, or maybe the disease burden related to your topic in one country versus another. So if your activity was on alcohol, you might compare UK alcohol policies and their effects with, say, Afghanistan, where the situation is totally different because of cultural and religious reasons.
And that cultural element that seemed really important in the guidance.
Crucial. They explicitly said, consider the cultural reasons why policies and disease patterns are different between countries. It's not just about the numbers, it's digging into the societal context underneath.
Okay. And you also need to tie your learning here to the idea of global citizenship.
Yeah, that sense of interconnectedness, our responsibilities beyond just our own country. How did doing this activity and learning from it make you think differently about being a global citizen?
Now, there was a really critical point they made here, wasn't there? About focus.
Yes, absolutely vital. This whole "so what" section has to be about your learning about these big global health themes, but seen through the lens of your specific activity and the prep work you did in weeks 1 and 2. It's not meant to be just a general summary of global health facts you found somewhere. You've got to show how your experience illuminated these bigger ideas for you.
And references still matter here, right? If you make factual points about policies or disease rates.
Definitely. Still need to back those up.
And given the word count, they suggested you might have to make a choice.
Yeah, that's right. You might need to decide. Either focus on comparing different countries in some detail, or focus more on linking your learning to specific sustainable development goals. Trying to do both in depth within maybe 400 words. Probably too much. The main thing is reflecting on what you learned from the activity in relation to these broader concepts. Choose what feels most relevant to your learning.
Okay, that makes sense. So moving on to the third part of that Rolfe model framework in the template, the now what?
Right. This section is all about looking ahead, taking the learning you identified in the so what and thinking about, well, appraising its significance. What does it mean? What are the impacts? What about actions for change?
This bit lines up with learning outcomes 4 and 5. And the most obvious question to ask yourself here is, what's going to change in my own practice as a nurse because of this? How will having this global perspective actually influence how I interact with patients, how I deliver care day to day?
Yeah, but they also encouraged thinking a bit wider than just immediate practice, especially as you're getting closer to qualifying. Think about how this learning might shape future roles if you, say, moved into research, or maybe policy advocacy. How would you actually try to advocate for change based on what you've learned?
They also brought up reflecting on effective teamwork and shared decision-making here.
And not just with patients, importantly, but also how you work with colleagues, maybe colleagues from different backgrounds or in different healthcare settings. How does that teamwork help make changes happen or feed into policy thinking?
There was a really specific example given here, too, about health information materials.
Oh, yeah, the leaflet example. Taking a standard leaflet, like maybe one about alcohol risks, and thinking critically about how you'd adapt it or explain it to help a patient from a completely different cultural background truly understand the information.
That seems incredibly relevant. It connects right back to the global context you explored earlier and really flags up cultural competence, doesn't it?
Definitely. And the guidance actually suggested, maybe looking back at your notes from past 3, if cultural competence was covered there. See how those ideas connect to your activity and how you'd apply that understanding in practice.
Okay. And then finally, but really important, it gets its own dedicated section in the template, the NMC Code.
Right. And this isn't just like a quick wrap-up or a standard conclusion. It's a separate, mandatory section, and the template gives it at least 100 words.
And the job here is very specific, isn't it?
Very. You must relate your activity and what you learned directly to the NMC Code. You need to pick out specific themes from the code, could be the broad ones, or you could dig into the sub-themes. But you can't just list them.
No, exactly. The guidance really stressed that you must explain and justify why these particular themes relate to what you did and learned. They use the phrase critically interpreting the code in relation to your learning, which sounds like you need to go into detail, give proper reasons, and really make the case for that connection.
Yeah, think of it like making a mini argument. Why does this specific learning experience highlight this aspect of my professional responsibilities under the code. And yes, you absolutely must reference the NMC Code itself in this section.
So it's about grounding that specific learning firmly within your professional identity and ethical framework as a nurse about to qualify.
Precisely.
All right, so let's maybe pull together some of the main takeaways, the key advice, and maybe some of those challenges they highlighted in the guidance session, how to tackle this essay effectively.
Okay, well, the number one thing, repeated again and again, was everything has to link back to that initial activity you chose. Don't wander off into general global health and forget the core experience you're reflecting on.
Right. Stay anchored. And tied closely to that is remembering the focus is on your learning.
Yes, even when you're discussing complex things like wider determinants or global patterns, the essay is about what you learned about those things. Because you did the activity and the prep work in weeks 1 and 2, it's demonstrating your integration of that knowledge, not just spitting facts back.
They also really pushed for thinking beyond just the local, didn't they?
Definitely. Actively challenge yourself. Think globally. Think culturally. Consider those inequalities, the different ways countries handle things through policy, and the cultural reasons behind those differences, all that stuff from the so what section.
And use the tools. That template, the rubric, they're not just hoops to jump through. They're actually designed to help guide your writing and structure your thoughts. Pay attention to them.
Good point. And also, leverage your past experiences. They suggested looking back at feedback from previous reflective essays, maybe essay 2 if you did one with a similar structure. That feedback might hold clues for you.
They also circled back to critical thinking, maybe referencing skills from past 3.
Yeah, looking for evidence, maybe even considering arguments for and against different policies or approaches when you're analyzing something in depth.
Yes, and they spent a bit of time clarifying those different academic verbs, which sounds key for hitting the marking criteria.
Like explain, examine, analyze, discuss those.
Yeah.
All mean go deep, right? Often need a balanced view evidence. Describe is just saying what happens.
But then appraise or critically explain or evaluate those demand justification. You have to give your reasons, weigh things up maybe.
Exactly. Understanding those action words tells you how to tackle each bit of the template.
And finally, if you're still scratching your head after looking at the guidance and the source material,
Use the discussion board. That's what it's there for. Ask specific questions.
okay, so we've kind of walked through that required structure, naming your activity, detailing what you learned, exploring so what that learning means globally and culturally, thinking about now what in terms of changes for practice and beyond, and then critically linking it all back to the NMC Code. We've pulled out those core principles and key strategies from the guidance notes.
And tackling an essay like this, it's really not just about picking boxes or getting marks, is it? It's about building a genuinely vital skill for your future as a nurse. That skill of synthesizing, of connecting a specific personal experience with these much bigger global contexts and also your professional duties, it forces you to join the dots.
Yeah, it encourages you to see that focusing on something quite specific, like your chosen activity on alcohol or vaccines or whatever, actually gives you a window onto this really complex web of health, culture, and policy that stretches right across the world.
Which leaves us with a final thought perhaps for you to mull over as you approach this task, or any task like it really. How does digging deep and reflecting on just one focused activity actually end up revealing the incredible interconnectedness of health across the globe? And maybe more profoundly, what does really understanding that interconnectedness mean for the global impact you personally can actually have starting right now, right here, with your own practice as a nurse?